Hello viewers, you're welcome to today's edition of Executive Health with Paddy on TNG TV. Today we'll be looking at the topic, your cervical health. And with us in the house is Dr. Olaleye Femi, and he'll be doing justice to that for us today. He's the MD of Optical Cancer Care Foundation. Dr. Femi Olaleye, you're welcome.
Thank you for having me.
It's a huge pleasure here. Very quick one. What is cervical cancer? What is cervical cancer in summary?
Yes, cancer of the cervix is actually called cervical cancer. And what more people need to know is what is the cervix? The cervix is the neck of the womb of a woman. It's the part of the womb that sits inside the vagina of a woman. So a cancer that affects that area is called cervical cancer.
Interesting. Thank you very much for that summarily one. Now we'll be looking at what are the causes of the different types of the different stages of the cancer we have. We just want to know there is an acronym DES that mostly comes up in cervical cancer cases. If you would help us throw more light on the stages of cervical cancer that there is.
Okay. Cervical cancer is one of the very few cancers that actually have a pre-cancerous stage. Pre-cancerous meaning there's cancer here, but there's a whole load of years
In between.
before the woman can actually develop cervical cancer. But the starting point of that process is called CIN, not DES.
Okay.
DES means diabetes testosterone, which has nothing to do with what we are discussing.
That's right. It's all right.
So CIN is the precancerous stage
Okay.
of the disease. Now the question, what makes women develop CIN disease?
Okay.
We now know it's actually one factor. There are a lot of factors involved, but there's only one singular factor that must be present, and that is sex.
Interesting.
Sex with a man.
Interesting.
And the presence of HPV during that sexual encounter increases the risk of that woman being exposed to HPV. HPV is what now influences the cells on the cervix to go through those changes that we now describe as CIN, cervical intraepithelial neoplasia. If CIN is not dealt with within a space of 5 or 15 years, it can actually develop into invasive squamous cell carcinoma. And
Wow.
there are two types of cancers that we can have cervical cancer. Cancer of the cervix happens, maybe if the camera can zoom into my finger, you can see a direct line that is dark at the top and lighter at the bottom.
Bottom. Okay.
There's something that's happened here. The cells here are different from the cells here. The same thing happens on the woman's cervix. So imagine the woman's cervix like this circle here.
Okay.
So the outer part is called the squamous side, and this side is called the columnar side.
Okay.
So cervical cancer happens at that junction in the cervix of the woman. We call it squamo-columnar junction.
Just at the junction.
Just at the junction.
Okay.
So there are two types of cancers. So if it's more of the squamous type, that's on this side, on the outside, we call it squamous carcinomas. But
Wow.
if it's more on the columnar side, we call them the adenocarcinomas.
Wow.
And those are usually these two types of cervical cancers you can get.
Okay. Okay. Thank you very much, Doc. Looking at you mentioned something. I think that should be an acronym HPV, and that's what
HPV stands for human papilloma virus. We are very aware of HIV, human immunodeficiency virus. And that is a very dangerous disease to contract, because however, can prevent contracting it through sex by using condoms.
Okay.
Or avoiding blood exchange.
Okay.
Or getting infected with somebody who had used a razor or a needle that's been infected with HIV. Those are ways in which you can prevent HIV. But HPV stands for human papilloma virus.
All right.
It resides locally like a normal organism on the bodies of men.
Okay.
And our bodies, when it comes in contact with the genitals and the bodies of women, we transfer that disease to them. Sex, as you know, is an in and out business. When a man wears condom, it doesn't stop the virus from getting to the woman. And that's how women get infected. 99% of men have this virus on their skin. Almost 80% of women will be infected in their lifetime. These are documented facts.
Wow.
So every woman, any woman out there watching this who had sex before, there's an 80% chance you've been infected already with a virus that will lead to cervical cancer.
Interesting.
I always tell people it's actually one of those things people don't know about. That if only they can just Google it, just type HPV into your Google browser right now, you'll be amazed how much information is out there on this virus.
Okay.
And it's a disease that we can prevent. And I'm happy we're talking about this today.
It's a pleasure.
So human papilloma virus is the commonest sexually transmitted virus. Full stop. If everybody understands that, then they know we are dealing with a very major disease here.
Now, that's an authoritative statement. Commonest.
It's the commonest sexually transmitted virus.
Interesting.
As documented by the World Health Organization.
Whoa, that's interesting. Okay, now we'll just look at the signs and symptoms of cervical cancer. Looking at the signs and symptoms, at what point does a woman have to go do her checkup? You know, what are the signs? How do they present? And so please.
I would be very happy to talk about the signs.
Okay.
But the point of note to women is that usually they shouldn't wait for signs.
Okay.
They shouldn't wait for symptoms. Once you start having sex, go and get screened. In fact, in developed countries, that's what they do.
Now, I think you should reiterate that
Yes.
once you start having sex.
Start having sexual exposure from the age of whenever your first sexual encounter could have been, then 2-3 years down the line, you should start checking your cervix. It's called screening. Because all women who come to do their test don't have symptoms. We don't expect them to have symptoms. By the time they are waiting for symptoms, which, by the way, are non-specific, they are not particularly only limited to cervical cancer. Women can have discharge, bleeding, in other conditions that are not only due to cervical cancer. So we expect women to start getting screened once they get sexually active. And that's one of the best ways to prevent the disease. However, if women are looking for symptoms, there are 3 important symptoms they need to worry about. One, the fact that there's something growing on the cervix, because cancer means there's a growth on the cervix. It means that there will be oozing and discharge of either blood or blood stains, discharge from the cervix.
Okay.
Usually this discharge doesn't go away. It's not something you can treat easily, and at times it doesn't respond to antibiotics. So that's a good sign. The other thing is if there's a growth there and somebody comes to have sex with a woman and is banging against the cervix, after the intercourse, what would follow would be blood. So we call that postcoital bleeding. In fact, any signs of bleeding that's irregular, women understand this. They know they bleed once a month. They have a cycle, they have a period. Any bleeding that is not explained as a period, then that's something you need to worry about. And the third one is, of course, painful intercourse and pelvic heaviness. The fact that there's something sitting down in your pelvis that you're not comfortable with can be a sign for some women. But like I pointed out, by the time all these signs are there, it's already an established disease.
Okay.
And there's really not much doctors can do to help such a woman.
Wow, interesting. So they shouldn't wait for the symptoms before they go for the checkup. Once you just start having sex, you get sexually active, you go for the checkups. That's a good one. That's a good one. Now, looking at what are the question I'm having on my mind now is how frequent should this test be? How frequent should women go for the test? Is it every 6 months? Is it yearly?
Very good. Okay. Very good question. We stress from a public health point of view that women should be aware of what's going on in their cervix every 2 to 3 years.
Okay.
That's depending on the test they're using. If you use the regular pap smear, maybe every 2 years. If you use liquid-based cytology or HPV screen, they could expand it to maybe 5 years. But in my practice, I recommend 2 to 3 years. Simply because if you give them such a long time, women can forget.
Lapse, okay.
And they will lapse.
Okay.
And therefore, you may miss an opportunity to quickly deal with something at an early stage. The idea of regular screening is based on the fact that we know so much about this disease. If a woman develops cervical cancer, HPV, or CIN at year 1, if you don't screen her until 5 years later, she won't die from cervical cancer. But you might catch her at the end stage of CIN3 before it leads to cancer. Or if you screen her in year 3, you probably pick out CIN1 or 2, which will be easy to treat and eradicate. And therefore, we recommend somewhere in between, which is the 2 to 3 years. How long should a woman screen for? the cutoff age for screening by the World Health Organization in most public health settings is 65 years old.
Okay.
Knowing that if a woman has been consistently screened and her cervix has been fine, by the time she's 65, she'll be fine. God forbid she contracts the disease after 65. It will take another 15 years before she can even die from it. So if you have 15 to 65, we reckon 80-year-old woman with cervical cancer has pretty done very well for herself. So we focus more on women that are younger and of course that are still very sexually active.
Okay, you just talked about the cutoff age. What's the minimal age? At
Again,
what point?
You answered that earlier.
Just
once
once.
you start having sex.
Okay.
The point when women have sex, the age they start having sex, cannot be easily determined. You know, we expect women to be mature before they have and give consent to sex. But we all know that there's teenage sex going on there. There are lots of funny men out there who believe that it's good for them to marry young women. In fact, we have part of the section of our country supporting underage children getting married to men. So you can imagine what's going on out there. A lot of these young girls are getting exposed to sex at 14, at 15 years to 14, 29. At 29, 30, they're coming down with cervical cancer. And the sad reality is that nobody's keeping scores, and simply the man moves on to marry somebody else, and the same cycle continues. So I'm very happy that we are having a discussion today, and a lot of women out there can know when they've had sex, and they can have 2-3 years to it, and they can know, oh, I need to go
screening. Okay, thank you very much, Doctor. Okay, look at that. One more thing. While you were doing your explanation just now, you mentioned CIN1, and you talked about CIN3, but I think the audience may not really know much about the CIN2 and 3, what it actually entails.
Yes,
what?
I did mention that earlier, that CIN is the progressive precancerous stage of the disease.
Okay.
So if a woman is going to have cervical cancer, she would have gone through CIN1, 2, and 3 before it leads to cancer, before it ends up in cancer.
Okay.
And it's shame that a lot of women don't turn up for screening. They only turn up when it's already cervical cancer.
Maligned.
So when I see a woman with cervical cancer, I automatically recognize that she had wasted 5-10 years earlier of me being able to do something, or anyone really doing something. But when they present with cervical cancer, it's too late. You want to know how common this disease is? It kills a woman every hour in this country.
Wow.
So by the time you look at 24 hours in a day, 20 women have died simply because we didn't save them, we didn't screen them 10 years prior to that point. And it's such a shame because our country does not have a national cervical cancer screening policy, which we have in developed countries. I've trained in England and I worked in England, and I understand the practice of the NHS in sending letters of reminders and of appointments for women to come for regular pap smear tests.
Whoa,
and those women, when they turn up, they get seen, they get sorted, they go back and live their life. So they live up to 80, 90. But women don't get this test done, and they die every hour. Just because it's not your mother, just because it's not your sister, just because it's not related to you, it's not enough. Our people should know that a disease is killing 20 women daily.
That's an alarming figure.
And that's about 10,000 women. You can check out these statistics on Global Cancer Study, Global Can. It's on Google. You can just type Global Cancer Study, and you see country by country analysis of women, how they die from this disease. It is such a shame that a woman would die from a disease that we could have prevented. And you know why it's so, I'm so passionate about this? Women form the bedrock of society. When you lose a woman, you've just lost an individual.
A nation.
You've lost a very concrete part of the society. And these women are quietly being sneaked away from us. And we need to do something about it. And that's why I'm very happy that you've given us a platform to get women to know about this silent killer.
If you were to do a proposal on this, what would you advise the government?
I'm tired of advising government because they don't listen. They don't even have time to listen to what we're talking about.
Okay, summarily.
Summarily, I would say put a screening center in every local government.
In
every local government in Nigeria has a health center. Every local government has a doctor, a medical officer of health responsible for them. Every local government has a matron and nurses. They already have the infrastructure.
Primary health care center.
Yes, they already do. All they need to do is just partner with people like us to to design a screening package that allows people to go in there and not be treated like rubbish. As you know, a lot of people don't want to go into public establishment because the sort of response they get, and make sure that people get a recall. You come today, you should have somebody reminding you. In this day and age of technology, you know, bulk SMS, you should have a register of people who have come in 2013. So in 2017, they should be due for their next appointment. So you send them reminders, and then you catalog them. You will be surprised at the statistics of women. Even in my own practice, I've screened 50,000 women since I got back from England 5 years ago. 50,000, average of 10,000 women a year. 10% of women I've screened are positive for these changes. 10%. So if we're screening 1 million women, we'll be able to save at least 100,000. By not screening them, it means in 10 years' time, about 1 million Nigerians, if there are only 10 million Nigerians, 10 million women in Nigeria, 1 million women will die from a disease that we could have prevented. And it doesn't cost more than what I've just told you. In fact, the test is so simple now that you can do it on a woman. She gets her results immediately. In my clinic, you even get a chance to see it on a TV screen. And all these are technology that we are now leveraging to make sure that women get to know about cervical cancer.
Oh, thank you very much. It's pathetic that these things go on this way in the country, but I believe a lot of change can come from people like you. I want you to let's look a bit at the diagnosis of cervical cancer, because I know a lot of these conditions, women shy away from them because they think they are invasive. But if you throw some light on it, yeah,
it's very easy for women to feel invaded. Of course, it's their private part we're talking about. So I understand. But a lot of women, once given the information, they don't mind. Particularly if they recognize that it's not painful. It's not a painful test, as long as sex is not painful. And we're not doing it on virgins. So a virgin has no risk of cervical cancer, so there's no point putting anything inside them. We use plastic instruments that are disposable, that are used only once on one person. So there's no risk of transfer infection from another person to you. And more importantly, you get this exciting feeling, particularly if you're okay, to see what your cervix looks like. And then you take care of it, the way you take care of your face. So if you see something abnormal in your cervix, you see it too. And that's the kind of test we do. We call it visual inspection with acetic acid.
Sorry, come again?
Visual inspection with acetic acid. That's
visual inspection with acetic acid.
VIAA, that's what it's called. And in my clinic, we add a colposcope to it, which is the camera that allows you to see it on the TV monitor. You know, just the way the camera is facing us right now, recording our image. You can record the image of the woman's cervix and display it on the TV screen, so she gets to see it too. And that's beautiful because it allows them to see what I'm saying. They allow them to get excited about, oh, my cervix is fine. Or it allows women to take action if she sees that something is going wrong. And it empowers them rather than frightening them. Because if you don't show them, they're thinking all sorts in their minds. But when they see it, yes, the anxiety is lower. So, oh, it's not more than this, so what do we do next? And a lot of women comply with with what we need to do. So the next question is, what else can we do to confirm the diagnosis? We can do a pap smear. We can do a biopsy, taking a pinch of that and sending for analysis. There's so much we can do to help women from dying from this disease. And finally, what else can we do to prevent it? We can give women a vaccine. There's a vaccine that's now available, HPV vaccine.
How affordable is it?
We'll come back to affordability. Let's talk about the science in a minute. Just like, just like the way vaccines were given to children. They are not really affordable. But thank goodness, because it's been subsidized by government, by a lot of organizations, polio, you know how we helped to get rid of polio, because somebody like Bill Gates donated large funding. So vaccines are not expected to be cheap. So, however, we recognize we need to eradicate these diseases. That's why government decided to, invest in them. For HPV vaccines, it's still a very expensive vaccine. The women are expected to pay for them, and it costs about 15,000 naira. And that's already even subsidized at my center. In some places, as high as 30,000.
And I believe it's a one-off thing.
And it's a one-off. We're taking 3 doses. One first month, second month, and 6 months later. All those 3 doses will be enough to give you my immunity for life.
Thank you very much, Doctor, for the session. Now we are onto myth or fact segment. This segment we get to squash some of the myths about health conditions that and some of the questions we have had people ask is, the first one is, HPV affects only people with multiple sex partners, so I don't need to worry about HPV vaccine or HPV tests.
That is partly true. The number of sexual partners you've had, the more likelihood that you would have met someone who would have infected you. But the fact that you have one sexual partner does not reduce the risk.
Okay.
Because that one person is enough to still infect. So a woman who's had just one sexual partner should go for screening. So the first part of that myth is correct. Women who have multiple sexual partners. What's the definition of multiple anyway? More than one.
Exactly.
If you have more than one sexual partner, that's multiple already. So anyone who's had more than one sexual partner is at risk and should go for screening. So the first part of it is true. The second part is not true, that no need to go for screening because you have only one partner. You should go for screening till the age of 65.
Okay. So I would just say this is a myth after all.
Yes,
so the second question here is, HPV infection clears up on its own, true or?
Yes, it is true. We know it's a very weak virus. Your immune system can clear it. But you don't know who. As a woman sitting in front of me in clinic, yes, HPV can clear it, but I don't know whether you are clearing it. And that's why I need to check.
Yeah. Okay.
Does that make sense? So if I have 1,000 women coming through my clinic, 900 of them will be fine.
Okay.
But 100 will need treatment, which is the 10% I was talking about. So 90% of women would have the virus, but they will not have the disease because they are able to clear it themselves. But they still need to come for screening.
So there should be
no way of knowing who the woman who has the good immunity to clear it.
So it should be deliberate.
Yes.
Okay.
Should be deliberate action.
Okay, so that makes this a myth. It's still a myth. Okay, the third one is, I can't have children now that I've had cervical cancer.
That's not true.
Okay.
I've had a woman who's had cervical cancer. I've treated it, she's fine, and she's able to have a child. In fact, women who are going through IVF, looking to get pregnant, one of the tests they are mandated to do is your pap smear. And from there, from the IVF clinics, they send them directly to me. And once I've treated them, I send them back, and they go have their baby. So again, they can have a baby after. So
this is a myth as well. That's squashed.
Of course, if the woman has full-blown cervical cancer and I've had to remove her womb, she won't be having any child.
Okay, so it just depends on the degree, the stage, Okay, thank you very much, doctors. Okay, the fourth one is, cervical cancer is wholly hereditary.
That's false. There's nothing hereditary about cervical cancer. It's all about sex.
Okay.
A virgin who has never had sex can never have cervical cancer, even if the mother had cervical cancer.
So it's just contagious, wholly contagious.
There's no genetic component to cervical cancer.
Okay, so that's a myth. You heard it. Foundation, the work you've been doing, and how people can actually access help via your foundation.
Thank you very much for giving us the opportunity. The foundation is Optimal Cancer Care Foundation. We are at 118 Paddy Thomas in Surrey, and we've opened another one in Ikorodu Township, 46 Beach Road, Ikorodu. Our aim is to make sure all women in Nigeria get the opportunity to get screened. And we make it free on Fridays.
Wow.
Women can turn up.
Did you say free on Fridays?
Free. They don't pay.
That's some interesting thing.
They only pay a registration fee of 500 naira, and they get screened. They just wait for their turn, like hundreds of women who turn up every Friday.
In both centers?
In both centers.
Okay.
Our hope is that more people get sense to come for screening, more people get together and organize screening in their faith-based organizations, in their corporate organizations, in their institutions, so that these tests become a part of our healthcare delivery system. We hope government can learn from what we are doing at the center and hopefully partner with us so that we can replicate this across the regions in Nigeria and save our women. Finally, women, please tell others, cervical cancer is a disease of ignorance.
Wow, that's a point.
It's a disease of ignorance. And some people have said, yes, if we don't want people to know anything, particularly our people, put in a book. Sadly, it is true. This information I've just shared with you has been around for the past 5 decades.
50 years.
Yes.
Thank you so very much, Doctor.
Thanks for having me.
We'd like to have more doctors like you who will be contributing so much to society.
Thank you very much.
That's the size of our package today. It was fun. It's always fun hanging out with my audience, and we'll hope you keep a date with us next time. Thank you very much.